You're watching Virginia This Morning. This segment is sponsored by Bon Secours Virginia Breast Center.
Well, breast cancer is sometimes found after symptoms appear, but with many women with breast cancer, they may have no symptoms at all. That's why getting regular mammograms is so important. Dr. Misti Wilson of Bon Secours Virginia Breast Center joins us this morning. It is great to have you. Thanks for being with us.
Thanks for having me.
This is an important topic of conversation no matter the time of year. Of course, with October being Breast Cancer Awareness Month, we're really focused on this topic. One of your office partners talked with us last week, Dr. Pellicane. You're here with us today. Really interesting because we were saying before we got started, almost level 201 that you and I get to talk today. And these are the questions that when you're seeing patients, they must have for you right after maybe being identified as having breast cancer.
Right. Well, you know, there's two principal concepts to breast cancer treatment, and one is standard of care have to remove the breast cancer. There's different ways of doing that, different surgeries. The other concept is we have to prevent the breast cancer from coming back or preventing recurrence. Breast cancer treatment is very patient-specific and tailored to each individual patient. So now that we're finding out more and more about cancers and the genetics of those cancers and how to treat individuals and tailor their treatment, it's becoming more specialized to each patient. So it can be a very complex journey at times.
That's really interesting, but probably also immensely challenging as a doctor because we're not one size fits all. And in this day and age, just like before, different women are coming in at different ages with different types of breast cancer.
Correct. We see all ages, ranging from anywhere in women in their 20s to women in their 90s. We have all types of patients, not just female patients. Males get breast cancer too, just not at the rate that is as often as females get breast cancer. But, you know, when people ask me, you know, what's the next step? You know, patients come into our breast center and we try to be very thorough and go over their pathology, their imaging results, show them their pictures, and that sort of helps the patient feel empowered that they get a full understanding of what's going on and what they can expect from not just their surgery, but their full treatment regimen.
So once it is identified, today's treatment options are?
Surgery-wise, so I would say we've made improvements across the board in the last 10 years for everything. So let's back up a little bit, start with screening. 3D mammogram, breast MRI for high-risk patients. So it starts from the very beginning, not just, you know, being identified. And then as far as treatment options, as far as surgery, it's not just lumpectomy, mastectomy anymore. It's oncoplastic surgery with reduction lumpectomy involving plastic techniques. It's skin and nipple sparing mastectomies for those patients that qualify. So, and reconstruction as far as using your own tissue flaps to implant reconstruction. So there's many options for women. And then as far as improvements in systemic treatment, as far as chemotherapy and radiation treatment, partial breast radiation, whole breast, I mean, there's just been so much improvement in the last 10 to 15 years to try to minimize complications for women and help them feel overall better about themselves going through the cancer treatment process.
Even in you telling me about these things, which, you know, are often some of the first things that first time I'm hearing it, it can be mind-boggling to a patient, right? So you want to work with a team, with
Correct.
A partner that knows these things.
Correct. So we call ourselves multidisciplinary based, so it's not just the breast surgeon that cares for you. You have a breast surgeon, you have a medical oncologist, sometimes a radiation oncologist if you need it, and so therefore we all work as a team and function as a team, which helps the patient feel safe and secure that everyone knows the treatment plan and what's happening. So at our breast center, that's what we try to encourage. And when we meet the patients, we try to empower them and give them as much knowledge and information as possible and help them also steer their treatment decisions, because it's just not what I'm telling you to do. It's also based on your own choice and decisions.
And that comes into play, but at that time, maybe if you've received diagnosis or a family member has, what should you do? What's the first thing that you do? Because you think, well, I want to go and research this, but you might be overwhelmed yourself, you know?
The first time you hear the word cancer is a dark place for people. And you just hear that word and your life changes. So when I meet with a patient, you know, take a step back. Don't go to the dark place. Most breast cancer patients do very well. So that's the first thing I say. Don't panic. try to not overwhelm yourself and go on the internet and get all this abundance of information without first meeting with your breast specialist. You know, they can help break things down for you and try to explain everything in a way that you understand it, as opposed to when you go on the internet for the first time, it's very mind-boggling and overwhelming. Yeah. So, and I think we do a good job trying to steer the treatment process with that.
I hear you loud and clear. Stay in the light, right? Stay and work with your team.
Don't go to the dark place.
That's right. Don't go to the dark place. Thank you so much for being with us.
Thank you for having me.
Shared some great information. The Bon Secours Virginia Breast Center has 3 convenient locations: Westchester Medical Park in Midlothian, 601 Watkins Center Parkway, Suite 200, St. Mary's Hospital in Richmond, 5875 Bremo Road, Suite G11 in the South Medical Building, and Memorial Regional Medical Center in Mechanicsville, 8220 Meadowbridge Road, Suite 309. For all the information and to schedule your appointment, call 594-3130 or visit the center's website. It's vabreastcenter.com. There's still more Virginia This Morning to come right after the break. We'll be right back.